we'll talk. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Father, thank you for this morning, and just pray that you would guide our words, thoughts, and deeds. Pray this in Jesus' name. Amen. So, good morning, everyone. Before we get to roll call, you want to make you aware that, and Seagull County Commissioner is not here today. But Mr. Turnbull called me a little while ago, and he is not well physically, and he said, I don't want to interrupt the meeting by running for the bathroom. So I said, stay home because I don't want it. All right, Mel, can we have roll call, please?
Commissioner Wingo? Here. Commissioner Mapes?
Here.
Commissioner Helley?
Here.
Commissioner Coons?
Here.
Commissioner Turnbull? Austin? Commissioner Higgins?
Here.
Commissioner Van Alstine?
Here.
Commissioner Chamberlain?
Here. Okay, I will take a motion to approve our agenda. I'll make that motion. 1 second. Moved and second. Any further discussion? Hearing none, can we have roll call there, please?
Commissioner Van Alstine?
Yes.
Commissioner Higgins?
Yes.
Commissioner Coons?
Yes.
Commissioner Mapes?
Yes.
Commissioner Helley?
Yes.
Commissioner Chamberlain?
Yes.
Commissioner Wingo?
Yes.
Motion carried.
Okay. Review and approval of our meeting minutes from September 5th, 2025. Would anyone like to make a motion to approve?
I'll make a motion. Second.
Moving second, any further discussion, any changes? Hearing and seeing none, can we have a roll call there, please?
Commissioner Higgins?
Yes.
Commissioner Mapes?
Yes.
Commissioner Helley?
Yes.
Commissioner Coons?
Yes.
Commissioner Van Alstine?
Yes.
Commissioner Chamberlain?
Yes.
Commissioner Wingo?
Yes.
Motion carried.
Okay, ladies and gentlemen, that moves us to public comment. If you would like to address the Board of Health, we would ask you to step to the podium, state your name and where you reside. You'll have 3 minutes to address the board, and I'll give you the courtesy 30 seconds when your time is about to expire. Would anyone like to address the Board of Health? Please step forward. Thank you, Mel.
It's on? Yeah, this is on. Okay, all right. So good morning. My name is Mary Fox, and I want to thank all of you for your presence in Otsego County this morning. I am an Otsego County resident, neighbor to lots of these fine people back here. Specifically, I live in Johannesburg. And I'm going to tell you just very briefly my background because I think it speaks to my credibility and the reason I'd like to speak to you. So I grew up in Johannesburg, but I'd never come back to a small town. And here I am living on the same farm my great grandparents founded a century ago. I left here to go to University of Michigan, where I studied, among other things, my undergraduate major was in biomedical sciences. And I went on from there, actually I was in medical school, but I didn't finish medical school. I didn't choose that as my career path. I did, however, go back and obtain my master's degree in the School of Public Health. So I say all that, not because I'm a gold blue kind of arrogant. We did drink it in the water, by the way, in case you wonder about the arrogance thing. But I say that because I think it speaks to my credibility. And I had an opportunity to review your packet in advance. And I want to reinforce and commend and support Dr. Myerson's recommendations on vaccines. I never thought in my career, much less my retirement, I would have to stand in front of a group of experts and commend you for following the science and the facts and not pseudoscience and not alternate facts. I appreciate Dr. Myerson's expertise. I appreciate everyone who listens to that expertise. And I want to commend the board and the staff and everyone here for your professionalism, your expertise, your leadership. And I want to add just one more personal note. When I'm not standing up here, I do a lot of volunteering in our community. I volunteer anywhere from 3 to 5 days a week in our elementary school, helping to support their literacy efforts. And I firmly believe the need for access to vaccines so that people like me can continue that important work. And quite honestly, while I believe everyone is entitled to their opinion, I don't believe they're entitled to
30 seconds.
jeopardize my health. So I appreciate you for taking the matter real seriously, and again, for being here in Otsego County. Thank you.
Would anyone else like to address the Board of Health?
Hello.
Yeah, try that, sorry.
I think no.
Oh, I don't need it.
Hi there. I'm Stephanie Jacobson and I am also a resident of Otsego County. It's very nice to see you all in our county. It is somewhat difficult sometimes. We're all busy, and to make a drive, to a Board of Health meeting, you're giving up a pretty good portion of your day. So I really appreciate everybody being here, and I think the turnout is great. A lot of neighbors, so I think that's wonderful too. And I just have a couple thoughts. I haven't been to a meeting in a while, but I do want to congratulate Shannon on her new job. And I also really appreciate her efforts to bring us back to the pre-COVID spending levels. I know she's done some work there, and I know the board did, and I think that is just and warranted. The other thing I would like to say is I realize there is a issue, and I didn't have time to really wrap my brain around it, but it's something to do with sanitation and the dumping of sewage into the drain pipes. And I guess I was quite shocked there wasn't really a law about this. But I guess my concern and my caution with that is when the Board of Health is making kind of what should be our elected representatives' laws, that is a very gray area, and nowhere did we see that more apparent than during COVID. And the problem with that is, as citizens, we don't have recourse against people that aren't elected. And, we do when you make laws, and I guess I was shocked that that wasn't a prosecutable offense, if that's even a word, but, so, just some caution there, and is there laws on the books? Can we enforce them rather than make new kind of quasi laws here? And then finally, I just really want to encourage, and I think nowhere was it more obvious than during COVID that we were really subject to the tyranny of the experts, where if people were deemed experts, the rest of us were supposed to shut up and follow them, no matter what the data was telling us. And we saw that with the drugs we were allowed to treat COVID with. We saw that with some untested vaccines that are now, a lot of data is coming in that show they're quite dangerous to specific populations. And we see that with some of the, go left, everyone has to go straight down a supermarket aisle because the science, and none of that was scientific, and it was wrong, quite frankly. So I just encourage you to do your own research on vaccines and the studies that brought them about. A lot of people that are recommending them benefited tremendously from doing so. So please, 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 if you're making recommendations on a vaccine schedule, start to look at the actual data. Thank you.
Would anyone else like to address the Board of Health? Okay, hearing and seeing none, public comment is now closed. That moves us to staff reports. Ms. Klanowski. Shanley. Thank you. Right.
I might just have to do that.
You want this one? Here.
Okay, thank you. Let's start this morning, this has been a very interesting budget season for us. I hope we don't do this again next year the way we did it this year, and it's not something that we did wrong or incorrect at our level, it's just the state and federal budgets very much affect our budget as the Department of Health. And so we've been waiting very patiently and trying to make sure that funding goes through. So when I wrote my board report, I actually wrote it twice because the first time I wrote it, then they passed the budget and then things changed, and so then I rewrote it. But when I wrote this version, I didn't know how the budget was going to affect our department. So I have those updates for you this morning. I guess first and foremost, the part, the governor has not signed it, so it's not official, and I believe she has until today to sign it and make it official. She does have the authority to redline and veto line items out of the budget, but from everything we are hearing, we are not expecting her to redline or veto the lines that would affect our budgets. So we're hoping that that gets approved and finalized today. The things that were in the state budget that I did want to address and talk about that affect our budget, first and foremost, was the per pupil funding that was rolled up. Some of our programs were rolled up into this per pupil funding. And although I understand the logic behind it, they wanted to give the schools more autonomy and authority to make decisions for what's best for them, and I can very much appreciate that. It would have resulted in our programs here at the health department not having enough funding to continue. So the therapists that we have in schools would not be there if this funding was rolled up. So we were very pleased to hear that it was unrolled. The other piece to that was our hearing, vision, and oral health screenings that we do. We've been doing these for decades, literally. And that was going to be rolled up again. It would not have been funded at the level that we could sustain doing that, and it was unrolled, so we were very, very pleased that that was unrolled. We're very thankful. I know Jen Mower especially did a lot of advocating and education to some of our state legislators, explaining what we do with these programs, how we do these programs, and how it would affect the students in the schools that we serve. So thank you, Jen. I appreciate that very much. The other piece that we saw in the state budget is the dental piece. There was potential that Medicaid adult dental services would have been underfunded. And I'm happy to report that that is still in the current state budget. It should be approved. We will not have a problem there. This would have affected all of our DCN clinics that we have across this northern part of Michigan. And those are safety net dental clinics. The patients that we are serving are typically adult Medicaid patients. And so we want to continue those services and providing the services. It is nearly impossible to get into a new dentist today. I don't know if you've tried, I have, it's hard. And if you are a Medicaid patient, it's even more difficult because there's a lot of paperwork and red tape that goes with filing those claims. And so that's the niche that we serve. We filled that void at this time. So we were very happy to hear that that will continue at the status quo. On the federal side of things, we all know we are in a government shutdown, federally speaking. I guess the biggest piece that we are watching from the health department's level is the WIC program. We have not been given any official guidance or any official communication that it would end, but we are watching very closely to make sure that the people that we serve and our clients will continue to get the benefits from that. I just have a quick, I've not been given anything officially as far as info or, you know, what's happening at the federal level, but I did pull a quick article that was sent to me, just kind of talking about the different sections and how it will affect public health. The CDC will not be available during this shutdown period to provide guidance to state and local health departments implementing programs to protect the public health. Grant funding announcements will not be prepared while we're in the shutdown. From the FDA, all activities related to imminent threats to the safety of human life or protection of property will continue. So that's good because we will still get guidance there if we should have a threat like that. And then on the USDA side, we do not have official information about the WIC program. So that's kind of in a nutshell. I know it's not much information, but we don't really have a lot of information to share at this time. So with all of that being said, I am happy to report that our budget was passed. We appreciate all of you getting that set. We did not shut down. I know one of our sister agencies did. But we, like most of the health departments across the state, have stayed open and are continuing to provide services to our. So thank you for that. One last thing, I would be remiss. You all should have received a save the date. We are doing our all staff gathering. It is Monday, November 10th from 9 to 3 at the Emmett County Fairgrounds. You are all invited to join us for the luncheon. And after that, we have a phenomenal guest speaker coming in. So if you're interested in staying for that, you're more than welcome. So that's all I have. Thank you.
Anybody have any questions for Shannon regarding her written report? Okay, any questions for any of our directors regarding their written reports? Okay, seeing none. Sorry.
Jeremy, same question, nothing from the state on the,
they did mention something that, one of the representatives was thinking about, reissuing it, or at least bringing it up again. But they haven't made any action on it yet. I think they've been working on the budget, and this one, so. So like that.
Okay, anything further for any of our directors? Okay, that then moves us to an oral report submitted by our community health director, Janine Home.
Check.
Yep, good there.
Thank you. I'm not actually making the oral report, but I am introducing the person who is. I'm Julie Pong. I'm the Director of Community Health Services at Benton County. And part of the Community Health Division is our oral health services. And it's something that has really grown significantly throughout the years, and mostly because of the commitment and direction of Dawn Reestrell, who is a Point City native, if I could say, like a local girl born and raised. And she is a registered dental hygienist for 40 years. And 30 of those years she practiced in private practice settings. So she came to public health after a significant amount of experience and really made a commitment to develop these programs. So we have a number of them that, really, the saying is that we provide oral health services from birth to senior citizens. And so that's a lot to juggle. Today, you're gonna specifically hear more about our Senior Smiles program. And I just wanna make sure, just give you a little bit about the program. It's really run in a way that's very convenient for our senior citizens. The oral health team schedules these types of clinics at our senior centers during big luncheons and things, events where they're already gathering there. And then the seniors can opt to participate or not. And part of the oral health screen has also been augmented with head and neck cancer screenings. And Dawn Reed will talk more about that, because we did a report last December where you heard about one gentleman who actually benefited greatly from that screening and was referred to a physician, and this is all about disease prevention. So part of what I want you to know about Dawn Marie is she actually is a sitting member on the State Board of Dentistry for her second term. It's not very common that someone is reappointed for a second term. She's also a member of the American Board of Dental Examiners and heads up the Northern Michigan Oral Health Coalition. So she comes with, a lot of experience. And I just wanna turn this over to her to make the presentation on our Senior Smiles program.
Thank you, Janine, and first of all, thank you for having me. I appreciate this opportunity. I feel bad because I want to tell you all about the Senior Smiles. As Janine said, we have lots of really wonderful programs that we do for our oral health, but one of my favorites is Senior Smiles. And Senior Smiles started about 7, maybe 8 years ago, and it's grant funded
through the Delta Dental Foundation. So, at any rate, when I first started it, it was more like a PowerPoint presentation where you went into a senior center and you kind of bored them with the PowerPoint presentation. And quickly, you know, you realize that seniors, and I'm seniors too, they want to talk, they want to visit, so I revamped the program, it's called Ask the Dental Hygienist, and most dental hygienists are extremely friendly. So it fits perfect, so we go to congregated meal sites in all the counties at, the Commission on Aging. And we set up, rethink the drink, so they have an educational piece that shows how much sugar is in drinks. But then we do a visiting style survey, so we go to every table and we just talk about, have you been to the dentist? Do you have problems? Can we help, you know, connect? And so we have a survey, we gathered that data, then we took it up a level. And like at congregated meal sites, they have foot clinics and seniors sign up for time slots at foot clinics, so we kind of modeled ours with, an oral health assessment and had that cancer screening, so they sign up. And it's gone over terrific, so we see, we've seen this past season, we've screened over 210 seniors that have opted into our head and neck cancer screening and oral health assessment, which then they have a one-on-one with the hygienist, and we can, connect to care if they need care, or help them find a dentist. And as Shannon mentioned, we have a problem because it's very difficult to get into dental, private practice dentists, or even our safety net clinics are backed up. So if a senior has a problem, or that veteran too, we're able to take that next step to really connect with care if they have urgent needs or issues that. So at any rate, the day goes like this: seniors like door prizes, so we have door prizes. If they fill out a survey, they get a little ticket and they get into the door prizes. They love to visit, and they really love to have that service done, in the clinical setting. So, let's see, the average age that, from our surveys is about 74 to 82 at congregated meal sites. It's mostly women, I would say a third, three quarters are women that are in the population or that age group. And like I said, I thank the COAs because we work with them to schedule. Last year we were in 19, Commission on Aging, our congregated meal sites, and it's growing. And again, I have a wonderful team of dental hygienists that provide the service. And it's also grant funded by the Delta Dental Foundation. Does anybody have any questions? So and we do it in the summertime because that's when the population is high. That's when the attendance, we wouldn't do it in the middle of the winter because it falls off. So we really, this is a summer program, and we travel to all the counties, congregated meal sites, and provide service.
Okay, thank you, Don. Anybody have any questions for Don Marie?
Just a comment, that is, it's so hard to find access to that, I appreciate that. Appreciate connecting to you.
Access to care, unmet needs for all my programs, it's a struggle right now, but again, we're just doing our best. And that's also discussed, it's being discussed at the state level too, how we can solve the workforce shortage and access to care issues. Thank you so much, I appreciate the time.
Okay, thank you. Okay. That then moves us to item number 8 on our agenda, Personnel and Finance Committee, Mr. Coombs.
Thank you. So the Personnel Finance Committee met 2015. We reviewed the August bills and the August employee expenses. And I would like to move and pay the August bill in the amount of $1,010,657.86.
Yeah. Moved and seconded, any further discussion? Hearing none, roll call please, ma'am.
Commissioner Wingo,
Yes.
Commissioner Coons,
Yes.
Commissioner Ganowski,
Yes.
Commissioner Howard,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Weaves,
Yes.
Commissioner Hamilton.
Yes.
Motion carried.
Okay.
We also discussed, employee expenses and reviewed those for August of 2025. And I would like to move that, for the payment of employee expenses of $23,009.40.
Moved and seconded, any further discussion there? Hearing and seeing none, can we have a roll call please?
Commissioner Ganowski,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Wingo,
Yes.
Commissioner Coons,
Yes.
Commissioner Howard,
Yes.
Commissioner Weaves,
Yes.
Commissioner Hamilton.
Yes.
Motion carried.
Thank you. That moves us into program and evaluation committee. No, you got it, okay. All right. Then move to item number 9, which is unfinished business. We have none. Move us into new business, the draft sanitary code. Very.
So I'm asking the board to approve the draft amendment to Article 12. As a reminder, the purpose of drafting this amendment was to provide kind of a clear direction on how enforcement for the health department was gonna play out in certain situations. And if you look at the old one, you can kind of see it was very brief. It just gave it cited a couple MCLs. And this one, it kind of gives a little more, it gives you the who and how. And, so the reason why I decided to draft this was because prosecutors in the past haven't looked at some of our cases and said, well, this is a civil man. Now, I'm not naive to think that a prosecutor is gonna take every case we give them. This would be reserved to, situations where, for instance, like there's a place in Central Lake that has sewage running down the road right there. And that instance is where the Antrim County prosecutor actually referred us to the Benzene sanitary code, which is actually pretty much word for word the same as Benzene enforcement section. So I didn't redo the wheel, and it is kind of vetted in Benzene in a way. And now I just adopted theirs and had our attorney look at it. So if there's any questions, concerns, please feel free, I'll answer them.
Yeah, I have a few things I want to discuss, but does anybody have any questions?
Do the motion and then have the discussion.
That's kind of certainly can.
Okay, thank you. I'd like to move that, we adopt the draft sanitary code for Article 12. Whereas the health department, Northwest Michigan Board of Health is empowered by the public health code to adopt regulations necessary for the code to carry out the duties and functions vested by the law and the health department. Any Michigan code law 333.2441. Whereas pursuant to this authority, Board of Health previously adopted certain environmental health regulations referred to as sanitary code. Whereas the Board of Health cannot be necessary to amend Article 12 of the municipal sanitary code to include clear enforcement provisions for violation of the district sanitary code. Now therefore, Board of Health hereby adopts the following amendments to Article 12 of the district sanitary code to take effect 45 days after approval of the Board of Commissioners for Charlotte and then see that. Pursuant to the authority granted under Michigan Code Law 332.241.
Okay, so it was moved by Mr. Coons, seconded by Mr. Van Alstine. Any further discussion? Mr. Van Alstine.
Jeremy, this has been to the 4 counties prosecutors.
I emailed the four counties, Charlevoix County prosecutor responded back within a few days. He's like, everything looks good. Antrim County prosecutor is the one that leaned towards, told me to go to this one. He didn't respond back when I when I sent email, but I think he's the one that told me this is a good one. And then, Otsego did not respond back, but I did talk to Josh and Diana, we emailed back and forth, I don't know, were you able to talk to the Otsego prosecutor?
Oh, sorry.
Yeah.
Dana.
I'm sorry. I
Oh,
apologize.
no, that is okay. No.
Okay. And then, Emma County has not responded.
Thank you, Chairman.
Further questions for Jeremy? Okay, so, since we are essentially writing law here, and I appreciate that you turned it over to the prosecutors. I have a question regarding some of the wording in here as it refers to the health officer in different areas throughout, I mean, we have 1, 2, 3, essentially 4 pages of, proposed change. And in some different spots here, for example, under 12.3, the first paragraph says, upon receipt of information that there's a violation of the code, the Board of Health or the health officer or the health officer's designated representative may, and then there's a few different things. That to me is correct wording. But then in different spots, for example, under 12.4, under restraining order, on the third line down, it says, then such health officer is authorized. Okay, we only have one health officer. So I think we need to add the language or the health officer's designee every spot that the health officer is referred to.
I do know, I can mark that on there, but I do know in the sanitary code, it defines health officer. And then it also says, or it can be a designated, a designated representative in the definition of health officer.
Okay, so I know which, you talking about this one?
Yeah, yeah,
Okay.
it would be under definitions. I'm
Okay.
sorry, I don't have it.
Okay. And if I'm wrong there, that's fine, I just wanna make sure that, because we are creating law and words matter.
No, you're right.
So, okay, so under definitions. Says the term health officer shall mean the director of the health department of Northwest Michigan or successor agency or health department serving the counties of Antrim, Charlevoix, Emmett, and Otsego. The health officer shall mean the person appointed by the Board of Health as health officer pursuant to Public Act. Any action which the health officer may perform pursuant to this code may be performed by an authorized, representative of the health officer. Such authorization may be made by the health officer or Board of Health in the absence or incapacity of the health officer. Okay. I just want to make sure that we're clear on that, and I do appreciate the definition there. I just don't like to give attorneys reason to argue.
Right.
Frankly. There's any attorneys present, take it personally if you want, but that's. You'd have to wait for public comment, sir. Okay, then I had a question on. The issuance of the civil citations. Is it our intent to have our sanitarians issuing citations? Or is that something that, I know you refer in here to sheriff's departments as well. I don't know if sheriff departments want to get involved in this, frankly, and I don't know if we, as a Board of Health, have the authority to empower a sheriff's department to issue those tickets. So I'm just not clear on that enforcement aspect.
Yeah, so anytime that we've had enforcement in the past, the prosecutors have always told us to have the sheriff's department issue the citation.
Mhm.
So I was gonna continue that, route on that.
Okay,
So this change is probably gonna stop you from legal review, if it's not, it will be, when it comes to our county for sure, so they're not gonna go on.
well, and that's, that's where we get into the fun part, because now, if the 8 of us, let's say, all agree, but one of our prosecutors says, nah, that doesn't work for me, we need to change this, I mean, it's just,
Well, then your county board will have to, I mean, they have to be approved by the county board, and I know like in every county, our civil council will review it, recommend and pass it or not.
civil counsel and then potentially the prosecutor, like Jeremy said, Emma hasn't responded, and I'm not digging you guys, I'm just saying.
Yeah.
So I don't know if it would be, are we putting the cart before the horse here to vote to approve this and then turn it over to our civil councils?
So this is, that's a problem.
Yes, Matt, our legal counsel reviewed it.
Matt Cross.
Yeah.
Yeah, this is approving the draft to go to each county, and then the county, once they say yes, then it comes back for final review, and you guys say yes.
That's a good sales statement, once they say that.
Say yes.
Okay, all right, I appreciate you, Jeremy. Okay, any other questions or comments regarding the proposed changes to the district health code? Or sanitary code? Okay, we've had a motion and a second to approve. We've had conversation. We would be approving this draft change, which then goes to each of our individual counties for review. Just because the 4 county boards have to vote to approve this as well.
Asking what one of us approved it before we actually,
Yeah.
before it actually. It's subject to the county, so.
If this-
If we change the motion, send it to counties for vote, I would be on. I think that's what the motion says.
That's what it says.
I understood it says.
Yeah, the 4th paragraph there is after approval by the board of commissioners. Is that clear that up, Mr. May?
Yeah.
Okay, okay,
That's what happened. When you're dealing with the.
I know. Every,
Mr. Chairman, I
Yes.
would appreciate more time to be able to talk to our prosecutor and our sheriff, since they would be involved in it.
okay,
They'll have that once they get sent, this gets sent to the counties. But this is like the very first step.
so I think there is a pause, if I can rephrase for Mr. Van Alstine, I think there is a pause. What we're voting is to say, yes, we as a board of health approve this, let's turn it over to the county boards for their review. And, frankly, Charlotte County may say, we're gonna give this to our civil council, we want our prosecutor to review, we want our sheriff to be on board. And then, so I think this is step number 1. How do you eat an elephant? One bite at a time. Okay, so I think this is the first step, but then as individual county boards, we can push the brakes and say, hold on. We want our civil council to review, we wanna discuss this with our sheriff, I think we have that opportunity.
I appreciate the conversation.
Okay. Anything further? Okay, hearing now, we have a motion and a second to approve this draft and send it to our county boards. Is that a proper restate of your?
Yes, that's how I understood.
Okay, thank you. Okay. Roll call, please, Mel.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Hankins,
Yes.
Commissioner Kelly,
Yes.
Commissioner Mapes.
Yes.
Commissioner Clue,
Yeah.
Commissioner Wingo,
No,
motion carried.
Under our, Shannon, help me out here. Under our bylaws. Are we allowed to approve a motion without at least one member from each county voting in the affirmative?
It does not say in your bylaws, and I can say that because I glanced at it just before this meeting.
Okay,
Because we have one person missing, and we didn't know if he was with Colin, so.
okay,
So I just reviewed it, it does not say that you have to have an affirmative vote, which can't be just saying.
okay, all right, very good. All right, thank you. So motion does carry. Thank you, Mel. That then moves us again, ladies and gentlemen, to public comment. If you would like to address the Board of Health, you'll have 3 minutes to do so. Again, I'll give you the courtesy 30 seconds notice when your time is about to expire. We would ask you to step to the podium, state your name and where you reside, and I'll start your 3 minutes after that. Would anyone like to address the Board of Health? Yes, ma'am.
Sheila Simpson, Gaylord,
Can you have
resident. Pardon me?
Mike?
Oh, there wasn't one. Okay, can you hear? I just want to affirm and thank the staff of public health. You are so collectively talented and experienced, and you do so much that the overall public doesn't even realize until they meet you. So I just thank you for being here so we can thank you in person. And to thank the board for your professionalism and your time commitment. As residents of each of your counties, it's a lot. And you carry yourselves with professionalism that really helps us trust better the decisions you're making. You ask good questions, and I just want to thank you on behalf of many of us in Otsego County and the other counties. Thank you.
Thank you, ma'am. You can keep talking if you're gonna comment. Well, Mr. Mason.
Mr. Chairman, Board, I have a question.
Please. Microphone.
Henry Mason, Otsego County. Question for Jeremy first. I sat on the Sanitary Board of Appeals for Otsego County. Are there any changes in this having to do with having any effect on the sanitary board?
On the appeals board,
Yeah, okay, thank you. Now, I thank God every day that many of your neighbors and mine, including myself, many thousands of us never got the vaccine. And contrary to popular belief, many in the health industry, the hospitals, et cetera, were nearly forced. Perhaps there were other places, but they did get exemptions with medical exemptions with the claiming religious exemption. That's where they ended up with their exemptions. And so I think it's fortunate, let us hope that it never comes down to being forced on us one day. Thank you.
Sure. Would anyone else like to address the Board of Health?
Sure.
I don't really need this. My name is Marcy O'Shane, Otsego County. Wow, I spent a lot of time traveling to you guys. And don't you agree it was a beautiful view on the way over here? I mean, especially when you guys came, the fall colors are just radiant right now. So what a time to have your first meeting over here, and I hope you continue to do so. We love to see you over here. I too am a non-vaxxed person. If that makes anybody want to stay more than 6 feet away from me, then by all means, I hope they do so. As far as the sewer thing, I think you were right on. Cart before the horse. You know, probably should have went to county first, then to you instead of boom, 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 back and forth. And I do agree with adding the verbiage that you, Mr. Hankins, said, because we are giving a little crick in there, and why not? Why not add those names to it so that any attorney can't just weasel his way in and say, and then you gotta delay the process, cause now we gotta go find definitions. So just put it in there, you know, not really sure why we're even discussing this. I guess there are people out there that are not aware that you should not dump your crap everywhere, but I'm thankful for you to bring it up and maybe get some of those people taken care of. I thank you for your time. Enjoy your ride home.
I will, have a side note also, Gaylord's gas is cheaper than Charlotte was. Yes, I'm filling up on the way home. Would anyone else? Yes, sir.
Pat King, Livingston Township, Otsego County. Ms. Wingo, thanks for being here. A couple things. Ms. Marcy and I have had discussions once or twice. The purpose of the vaccine for COVID is not to prevent you from getting COVID, it's to prevent you from dying. And speaking as somebody who's had open heart surgery, I'm grateful for the availability of the vaccine. One of the gentlemen that was on the FDA approval board, Dr. Arnold Monto, epidemiologist from the University of Michigan. He was an expert witness I used on a variety of cases, and a brilliant man. He's not getting his news and information from Fox. That's that. Sanitary code, without enforcement, it's a suggestion. You need to have that. Thank you.
Would anyone else like to address the board of health? You two behave yourself.
This is how you cross the aisle and love each other.
Golf course. Single.
Go ahead, ma'am.
I just had to get up here as the middle of a problem children. It scared me. My name is Ally Godiva. I'm a resident of Otsego County in Vanderbilt, Michigan. And, there's a lot of talk about the vaccines and, I'm a very opinionated person, quite frankly, but I also like to be very rational and reasonable. And, as it's been said here, you know, yes, there are people in high risk communities that may benefit from a vaccine because they, you know, they could die from it. But there are also people that are very healthy. They have healthy immune systems that are doing exactly what God intended them to do, which is to strengthen themselves through being stressed by viruses and bacteria and become healthier and stronger. And I think it's important that we acknowledge we live in a free country where we have the ability to make those decisions for ourselves, have those resources there for those who feel they need them, and also be allowed to voice our opinion on not putting things in our bodies that we don't feel comfortable with. You know, we have laws to keep heroin out of our bodies, cocaine out of our bodies, because they're dangerous, and you know, that's anything we put in our body can be dangerous to the right person. So I think it's important that we all be allowed to have that freedom in this free country to make that decision for ourselves. And you know, I really just respect everybody's openness who has the who feels comfortable speaking out on it, because I'd just like to see this country be free and for everybody to be allowed to express their opinions, whether they be online or not. So that's all I have.
Thank you. Would anyone else? Yes, sir.
Sure. Lauren, here in Gaylord. I'm glad to hear the term the availability of the vaccine. I think that's entirely accurate. It's interesting that there are those amongst us who would compel certain medications, but we license, and I don't know the figures on this. I'm an alcoholic counselor by trade for one thing. But I wonder how many deaths occur between tobacco, alcohol, and recreational drugs, which are certified and we make money off of them, tax dollars. But we want to regulate certain other medicines and be very persuasive, not compulsive. Just an interesting thought. We need to be careful. We guarantee people's rights. Thank you.
Would anyone else like to address the Board of Health? Going once. Going twice. Okay, public comment is now closed. That moves us then to commissioners' comments. Mr. Coombs.
I'll pass.
Mr. Mayor, so Mr. Helwig. Good. Mr. Van Alstine. Ms. Wingo.
Yes, thank you so much for this game. First of all, I want to thank the board for coming here to, and would also ask the board to consider making this a yearly thing to come once a year here at Single County. If you could give that consideration, I'd appreciate that. And second thing is, so I stressed that I wanted to talk to the prosecutor and the sheriff about enforcement on this. Can I get a copy that I can have to, have them go over and
Jeremy will give you all the copies you want.
would be great. All right, thank you.
Anything further? Mr. Chamberlain.
I was just on a lighter note, I think we forgot the jar we said money for every time someone said that C word.
Oh, that's right. Everybody who mentioned COVID, you owe us a dollar. You know how at home you have the cost jar, you put your money in, when you say so, I should. That's a joke. That's a joke. Okay, I have no further comment, and I will take a motion to adjourn. Moved and seconded, all in favor, say aye. Aye. Any opposed? Thank you, folks. Have a great day.